So it's the, is it 21st of September? Well, it's Wednesday. Um, I was just listening to BBC Radio Ken, and he was interviewing I just caught the end of it, and he's talking to, he was a former, I love when they always former head of East Kent Hospitals or whatever. And he's going on and on and on about, and he said, no, we should be worried. Worry doesn't solve anything, mister, whoever you are. And also, he's telling people to go and get the flu jab and to get the COVID vaccine. Now, it's already proven the COVID vaccine has actually killed a lot of people. So he's still selling that. Must be sponsored by a pharmaceutical company. And the flu jab, rubbish. Flu jab for certain people, yes. I just spoke with one guy today, and he said the thing is, they keep sending it out, tell people go and get the flu jab, but they can't get through anyway to make appointments. No one can get an appointment for anything. People just hanging on the phone. Everywhere I hear people talking about this, it's non-stop. Now, I remember when my parents were alive, and each time they had the flu jab, they got very, very sick. And I said, don't have it. And the 2 years before they passed away, they didn't have the flu jab and they were fine. If you're healthy, it's normal. We've had flu for years. I mean, it's not like the Spanish flu or something like that. It's only 40% of any use. And and he's just talking a load of rubbish. We need to do this, we need to do that, and then tell people to go and put more poison in their bodies. It's been going on for years. You need to eat properly. We had flus. Yeah, I mean, I remember saying to Mum, and this was, my grandparents. They never took any tablets of any kind of stuff, and they worked very hard. I mean, they're physical hard work, and I still see, because it was a farming community, and you still see people walking a lot, still walking, carrying bales of hay on their back and everything like that. And I never had the flu jab. I don't want it. Whenever I get a sniffle, everyone's, oh, I've got flu. You've got a cold. Man cold. Then the flu, then they're dying. But anyway, now you wonder why I am posting this. I am lying in bed. It's because I'm on day 2 of my super heavy period. So I'm in perimenopause. Now, I do, and I normally cope with this quite well. I don't take any I take maybe half a paracetamol, but it's very painful and it does exhaust you. So women that have that, I have 2 periods a month, and I've had that now for maybe 16, 17 months, and it does wipe you out. And I do say to women, you need iron. Women, you get to a certain age, and men as well, because men, okay, well, let me backtrack a bit here, because there's so much to cover on the health side of things. I've got massive experience in healthcare. I have studied the anatomy and physics, what the doctors study to a certain degree, and also alternative, complementary health. And I would actually call it alternative health methods as opposed to complementary, because that's changed by now. It's just in the old days. If you ate well, you ate properly, nutritious food. You don't have to eat lots of it, but you need, it's this time, it's starting to get cold. I can feel it's the last day of summer today, officially. And you can feel the chill in the air. I can feel it. Put more clothes on. I see people still walking around in flip-flops and shorts. And then, oh, I feel sick. Well, what do you expect? It's winter time. Because what they do, they've got the heating on so high in the house, they probably won't anymore, because now the heating bills have gone up. And, you don't need, it's winter. You put extra clothes on. That, for a start. I've just had a bowl of tomato soup, out of a tin. It's nice and warm. It's lovely. And, I've just climbed into bed. I've got that on. I've got a blanket on, and I'm going to work from bed, but I'm going to sleep a little bit. because I work very, very, very long hours. But I've already done an 8.5 kilometre walk this morning to get the blood flowing. You need blood flow. If your blood flows, it's better for you. Don't running and bumping and this, that, and the other. I just found all the stuff for the physio for when I broke my ankle. And the amount of people, I spoke to a lovely lady the other day. She must be in her 70, 75 or something. And she's just around the corner. She broke her elbow and broke her hip, literally crossing the road here. And the state of the roads here and the pavements are absolutely horrendous. You would think they did have an earthquake here. But, yeah, so, because they don't fix the roads here. They're horrendous, and the pavements and everything. I've never seen so many people walking around on crutches or in wheelie chairs or anything. And you say, what happened? Pavement. And I'm very, very careful where I walk and how I walk. I know where all the trip bits are, everything. I did trip up the pavement last year and really, scratched open my knees badly. I was lucky that I didn't break them. And it was because the curb is too high. It shouldn't be that high. They can't even build stuff properly here. And they're wasting money on all these fancy this, that, and the other, instead of fixing stuff so that people can actually live healthily. You have to have a foundation. People need, homes that aren't leaking energy, with windows that close properly, etc. I'm very lucky in this house that whoever the previous, not the previous owner, but the one before, he was a builder, so everything was made very well, built properly. And these are old houses. This is from 1900 or something. I don't know. I need to look at the deeds. And luckily, they never had heating in those days. It would have been heated by a fire. My chimney's blocked now. It's blocked over, and we're not. I think. Anyway, I'm not sure, but it's fine. But I actually don't really need the heating on. In fact, I've gone for ages without heating. It hasn't really bothered me. Just put an extra layer on. But I've seen going to a lot of people's homes and it's absolutely boiling hot and they're all sitting around in t-shirts and shorts. And then when they go out, they're always bloody freezing, and then they all get sick. And then they stay at home and they got the heating on so hot and they don't open the windows so they don't get any fresh air. It's their own stupidity, really, and it's laziness. And the no education hasn't carried on. So, of course, people are moaning about, oh my God, my heating bill's going to go through the roof and going to go through the roof. I'm not surprised. You've got the heating up, the boiler up as hot as it can go, the heating up as hot as it can go. It's no good for you. Don't open the windows, you don't get fresh air. And you've got those storage heaters that blow out hot air or whatever, and whatever goes on. You've got tumble dryers running non-stop, which puts damp in the air if you don't have proper extraction. And you're wasting energy. And everything's connected to everything. It's not rocket science. I keep saying that, it keeps coming up rocket science. Right? I must have to build a rocket, get off to the moon. Anyway, let's go back to health. Now, I asked a doctor how many hours of training do you have to do on food and nutrition a year? And I think they do. This is probably an over an exaggeration. A 1 day course. A 1 day course. Not even that. I've spoken to nutritionists employed by the NHS and blah, blah, blah. And I've sat and I've talked to them. They have no clue. Sorry. And they've done a 3-4 year degree or whatever they say. And I've said, but you can't have that with that. That interferes with that. Oh, we don't know about that. So I said, you don't know about the food that interferes with the medication that the patients are on. They can't have that with that. So it's a bit, but they're not trained properly. This is why the money is wasted in the NHS, because they don't have proper training. So if you've got lay people going to people who think that they think the doctor knows, the nurse knows, the blah blah, and they don't, because they don't have proper training. They haven't got a clue because they don't see the body as a whole. It's intended to this department and that department and this department, and none of them actually connect with each other. That's the biggest problem in healthcare. And you just listening to people, you can see it. You listen to people, and this is the biggest problem. They don't do. They do not listen to the patients. I had that. I've had a couple of nurses I've spoken to about it, and they're not from here. They've trained elsewhere, and they said, "You're completely right. We need to listen to the patients," and you don't. There is your biggest problem, NHS, and there's your biggest waste of money, apart from on all these execs who get paid so much money, who haven't got a clue, got no clue about healthcare. Who's our current health secretary? I don't know who it is now, but I bet they have no clue, no healthcare training whatsoever. And that's that. And I'm going to have a snooze now because I'm super tired. So I really do wish you good health, and I'm very lucky on our team. We have it, and we share a lot of most of the knowledge that we have. We share it for free, just because I can see there's such a need for it. We all see there's a massive need for it, and that will be part of the One Sock Foundation that I'm developing. I have been developing for years, and that will be food and nutrition, and I'm already doing that with a food bank diet cookbook. I've been doing that for years. So that's where you got to start. What you put in you, it can either fix you, it can just sustain you, or it can kill you.